this is the review. Before Dr. Fulton share his experience to the audience, I want to show what he used to look like before. So that's where he was. Again, when you have a receding hairline, you tend to look older because you lose the framing of your face. So we drop an inch here, and then you see, look how handsome he looked now. Close-up view before and afterward. Very good. So now I'm going to leave the stage to Dr. Fulton. And so why don't you start with, how hair loss affected you, and then what your research about, and then why you chose the clinic, and then and if you can share what's experience surgery day like. Go ahead.
Yeah, I think over the years I didn't even notice, because it was so gradual, the hair loss, and I was just cutting my hair shorter and shorter, and eventually it became just very obvious I wasn't going to have much hair left, so I looked into options, and as a surgeon I reached out to my own colleagues to say, who do you know, who can I find, and so finding someone that I could trust was a big deal. So one of my colleagues referred me to Dr. Diep, and I was really lucky for that. I looked into a lot of options, including travel, and saw all the videos that probably a lot of people see, and finding someplace local that I could go to where I could really be sure what I was going into was important. My surgery date was on my birthday.
Oh my God!
So
really?
That's how we celebrated. It was.
Oh, that's why I remember we got you a birthday cake, a cupcake.
Yeah, a cupcake. Yeah.
Yeah. Okay.
I watched the whole series of the '90s show on medication, but the so it was very memorable. It was a long time. I think some of the things I didn't realize was some of the details. It's really all day experience. The medications and the staff made it very comfortable.
Okay.
I'm a surgeon, obviously, so I'm used to kind of guiding people through surgery, but I still didn't really know what to expect going through it myself. So I think that was an advantage to have some idea, but still, you don't really know until you go through it. But it was very comfortable. The first 3 days, it was just odd to sort of sit in a certain way, but that got much better after the first 3 days. Everyone would ask me about pain, and I'd say there was virtually no pain the whole time. I think the initial healing is impressive the way it looks, but it was really just fine. I think that worked out really well. The healing after several months, right away you get an idea. You say, oh my gosh, look, all the hair is there. That was really great. And about the 3rd month it started to fade away, and then I could see some redness, and then about the 4th month into the 5th month they got much thicker, sort of came back, and in 6 months it looked about like I had a full set of hair, but it was short at that time. This continued to grow. Then I had to order combs on Amazon because I finally had to comb my hair, but so that was sort of several of the months there.
It's precious actually, because this great story about ordering comb, because we take it for granted, right? And guy who don't lose hair, so we just take it for granted. We have all different kind of comb, but then for client who losing hair, and they don't, they never use it that much, and when they have to order it, it's amazing story. It's something that it's I took it to heart actually when I hear those kind of story. Well, I'm sorry to interrupt. Go ahead.
No, I think I didn't necessarily feel like I needed to go through the surgery for probably several years, because I figured I'll just deal with hair loss. But when I knew there was another way to not go through hair loss and to have a great outcome and feel like I could go through a surgery that I could really trust what I was going through, I got a little more confidence in actually going through it, and I didn't feel like I was taking a risk, and I was ecstatic at the outcome. It was just nice to not have to sort of just cut my hair as short as possible all the time. Finally be able to figure out what kind of hairstyle I might need to have. My wife's been very positive about it, and very happy with it, and she suggested I go to a different country to go get it done, and I said, I want to go where I can be followed and checked on and make sure everything's okay. So I think that's great.
Well, as a surgeon yourself, you go through this stuff, and you can't just trust what's outside the country, because it's not just about the surgical skill of the surgeon, but about the aftercare, and the aftercare is important, right?
Yeah.
Whether you have infection, whether you have it going on, being local is a benefit because you can always come by, you know.
Yeah, we have people that travel to see me for a surgery sometimes, but then it makes me nervous when they can't follow up right away. So
Mhm.
having the ability to kind of see how someone's doing, I think, is just valuable.
Mhm.
Yeah.
But the other important thing too is, you know, when they talk about doing surgery outside the country, it's not the surgeon who's operating, you know that. It's 100% of them operated by technician. Technician is anybody who works, you know, where not, they don't have a medical license, so they practice, they were trained in 3-4 months,
Right.
and then they expect you at harvesting and
Well,
operating you.
Yeah, I looked at it like in general surgery and in a hospital, we have a whole team that takes care of somebody all the time. So we'll have nurse practitioners, we'll have PAs, we'll have first assist nurses, we'll have the anesthesiologist, we have a scrub tech, and so we have everybody really to get the surgery done. Without that, you can't have one person doing everything. So I think
Right.
it was the whole team, and it was, I thought there was a lot of competence in everyone that was taking care of me. So
Yeah.
that was something I only realized when I went through it, because that's something I think anyone would be nervous about, because you don't know who you're going to meet and how you're going to be taken care of till you're there.
Yeah. You know, doing like the gallbladder, doing something more invasive, you know, having you've been trained for years and years, right? So that's why it's safer to have a surgeon really actually do the main operation. And, you know, personally for me too, if I go in the hospital with gallbladder, I don't want to just technician operating my gallbladder or, you know, any stomach. But let alone, this is your face. This is cosmetic, you know. And I understand the price is cheaper outside the country. We just can't compete it. But that doesn't mean, you know, we cannot produce. And I'm very confident with our result. It's more superior, but it's safer as well. So,
Yeah.
but
The artistry of it too is, you know, not to be understated. You know, you can see a lot of things where people try to get 5 or 6,000 grafts all at once. And I think the sort of careful consideration of how you're doing the front of the hairline is really important, so that you're not sort of taking too many grafts and piling them into one area, or you're really kind of placing them where they need to be. And if there needs to be something done in the future, you can talk about that. But I think that was really so a lot of forethought into how many number of grafts, where they're going to be placed, not too many. And I think sometimes when you see the videos online, there's a lot where they have everything. It's just overwhelming.
Well, if they say 4,000-5,000 grafts, you gotta understand that sometimes those numbers cannot be real too. So they punch in 4,000-5,000 times, doesn't mean the graft is healthy.
Yeah.
So they just transplant those unhealthy grafts for one as well. Number 2 is you don't want to over harvest, and that's the key, because you want to save your donor to allow it to heal. There's a point of no return. So if we go for 5,000 grafts, which I'm very capable if I really wanted to, but the problem is there's a point of no return, and we not only destroy the scalp so much that the hair that we didn't take out will die, and the hair that we partially successful take out, and some of those root can grow back, but because we did too much damage, they all die, and then you end up being really bald in the back. So you're creating more trouble. So then, this is what we do. We say, hey, you know what? We want to make sure that number 1 rule is the patient safety. We want to make sure we look not just doing surgery now, but we want to look for your future. So we want to make sure that you heal well with the scalp, because over harvest can have necrosis too, and you got to be careful with that. But the other important factor is you want the scalp to heal well, so then the hair will grow back, and then you can always come back to the wells and get some more graft, and then do more and more in the future.
Yeah.
So it's just all about not just about graft, about planning,
Yeah.
safety, and the
thing
future donor.
The thing I think people struggle with, that I was sort of thinking about for a while, was the strip versus FUE.
Yeah.
And to me, seeing the outcome of the pictures and, you know, having an idea what FUE was, I think that was, I didn't really want to have a scar. I didn't want to have a healing of a scar, and so I thought that was nice. Although technically there's more scar with FUE over this whole area.
That's true. People don't realize that.
It's sort of a misconception.
Yeah.
And I think that the strip would have been just fine and it would have healed well. So I think trying to decide is a very individual choice. How people want to wear their hair, what kind of healing to go through. So I don't think it's probably a wrong way one way or another, but seeing the photos helps kind of decide. And I felt like I could get the kind of surgery I wanted with the FUE technique. So.
Absolutely. And, you know, and you yourself, right, know that. But the reality is the FUT is more invasive. It's actually cutting the scalp out.
Yeah.
Same thing when you, with operation nowadays, when you do the gallbladder and those stuff, you really don't want to cut the patient's stomach out, right? I mean, you know, you want to do laparoscopic or even smaller, right?
Right.
And you heal better.
Yeah, there's nobody that comes in and says, please give me a big incision. It's always smaller incisions, so it probably would be a good result, but it's just counterintuitive to think you're going to want to have a large incision.
But you can relate to that, and I think you choose the right choice. And again, there's a surgeon who really know how to do FUE, and there's only 10% of us are true FUE specialists. Well, we can do it manually by our own hand. And I was trained in Beverly Hills how to do that 20 years ago, actually. And there's just only 10% of us can do that. But there's the rest of them, 90%, they just don't really know how to do it, but they buy a machine to do it. You know, robots and all that stuff. And I'll be honest with you, those are not really hair surgeons, and they don't really know what to do. They just get the graft from the machine to do it. If the robot is better than me, there's no reason why I won't buy 5 machines and then let them do it, and then it better I don't have carpal tunnel syndrome. Won't tire myself out, and financially it will make more sense. But the reality is, ultimately, we do by manual is number one is to create the best result for the patient, and we can harvest the most healthiest roots. And that's why being a manual hair surgeon by the FUE method, manual FUE is the best. Robot is not going to give you the same quality graft. And the third and the bottom one is called NeoGraft or Smart Graft, and those tend to be, people don't understand, that those tend to be like outside the country. The doctor doesn't even know how to do surgery. They don't even touch you, and they won't be around. So the 100% operated by a technician, design the hairline, harvesting the graft, and then placing the graft. And then I had to fix some of the patient actually, Dr. Fulton. Some patient from Europe, out of country, they had it done. They came with poor density, poor result. But they told me that it's very dangerous because they end up like bleeding, passing out, and then no doctor around. They end up being in the hospital.
Yeah, no, that's a really important thing. I think during the surgery, I don't remember what hour it was, but the whole event was around 16 hours, I think.
Yeah,
at the time.
absolutely.
And so there was a time period where I needed to have some IV fluid and I felt dizzy, and if you don't have someone that's trained to be able to come check on you, I don't really know how you're going to feel comfortable going through that. You know, you have to have someone able to medically evaluate you, so that's a risk. Yeah,
it's, you know, you can train anybody to do surgery, but there's a reason why we go through residency and all these long years and our work and study is to number one is to avoid getting yourself in trouble, avoid getting to complication. And then if you do get into complication, they will teach you how to get out of complication. And then to, number one, the other important thing is to protect the patient, to know how to monitor and prevent any, bad complication. And that's what really separate being a surgeon and a doctor versus, people who are not trained and then they do an outside patient. But I really appreciate Dr. Fulton to share your experience with the viewer and the audience, and so they can get a glimpse of what hair transplant surgery is like and the journey. And again, there's a reason why the price in US is different than outside the country. But I'm very confident with our work, and we can give you the most natural work, natural hairline, but the best density as well. Okay?
Right.
Thank you.
Yeah, thank you.